Well, you all are in for a treat today because I am here with Marilynn Rothen at the University of Washington, and she's going to speak with us about the researcher role. So welcome, Marilynn, to our Professional Practicum course.
Thank you, Kelly.
Yeah. Would you mind please giving us a little bit of a sense of your background in dental hygiene and how you came to becoming a researcher here at the university?
Sure. Okay. So here at the university, I'm on the School of Dentistry faculty. I'm a clinical associate professor. And so that's one of my roles on the faculty, where I'm actually direct the dental hygiene Master of Science program. And then my other hat is that I am the implementation research manager for the Dental Research Center here in the School of Dentistry. So those are my two main roles. And in terms of how I got to be in these roles, when I graduated from hygiene school, which was several decades ago, I first worked in Perio for about 3 years. And then from there, I knew you could practice as a hygienist in Switzerland, so I went to Switzerland. And I practiced there for a little over 6 years. And at the end of that time, when I came back to the U.S., I wanted to do something besides private practice. So I began to look around at what my options were. And one of the first things I did is I became a clinical instructor at Pierce College dental hygiene program. And after that, it's actually while I was there, they had a lecturer come to speak to the class who was a psychologist who worked in the Dental Affairs Research Clinic here at the University of Washington. And Tracy Getz talked to the class about working with fearful patients and explained that the practice here was growing and they were actually looking for more hygiene time, if you will. And so I talked to him about potentially working in that clinic, and I began working there and working in the hospital dental clinic at the same time. Everybody who worked in the Dental Affairs Research Clinic, there were 2 dentists, then 2 hygienists, and 2 psychologists, actually was involved in research. So I indicated to them that, given the opportunity, that's something that I would like to do. And when the opportunity came along, my first experience with it was actually doing a toothbrush study. There was a Japanese company that wanted to introduce an electric toothbrush to the U.S., and to do that, we went out on Sunday mornings to a church population. And there we, as there was a team of hygienists, there were 6 hygienists and then 6 people to assist and record for us. And we basically did the gingerl index on the people who volunteered and consented to be in the study. And then they were randomized to either a manual toothbrush or this new electric toothbrush. And we did that every Sunday morning for about 3 months. So that was my introduction to research. And from there, I was asked to then participate in what was a 5-year grant on a drug tolerance study that used nitrous oxide. And that was done in conjunction with another study that was looking at alcoholics and their tolerance to local anesthetic and nitrous oxide. So what was fun about that was I could be the project manager for both those studies, doing all the recruiting for the study and actually seeing the patients because, of course, as you know, hygienists in Washington can administer both local anesthetic and nitrous oxide. So, it was a perfect fit. So that was my introduction. That's how I got into research. And when that 5-year grant was over, then they asked me to manage the Dental Research Center.
Fantastic. Amazing.
So that was, and of course, then eventually you and I worked together here when I was lucky enough to hire you as a research dental assistant. Yeah. So,
I was the lucky one. And I was going to tell you guys this, that Marilynn, she was the first hygienist that introduced me to the idea that a hygienist can be a researcher. I did not know that was a possibility when I first was hired here at the university. I was hired as a dental assistant. I was not a hygienist yet, although many of my duties were similar to those of a study coordinator. And everything that I learned about research at that time, I learned from Marilynn. And some of my coworkers at the time, they were very helpful in teaching me, and I thought it was so fun. I really, really liked it, and I feel like maybe one of the only reasons why I left here was because I was accepted into dental hygiene school, and so it was bittersweet, of course, because I was still following my dream of being a hygienist. So, Marilynn, on a day-to-day basis, what is it that you do?
Well, that's a very good question.
Yeah.
Because I have to say I do so many different things. That's a little bit difficult to answer on a day-to-day basis. But I have been involved in patient care throughout my time in research up until just very recently. So providing patient care a day a week. And I will just say that I think that is actually very important because in research, sometimes you can, get into the details of it because it can be very precise, and it's a great balance. It keeps the reason the research is important is because you can do better patient care, and then when you do the patient care, it actually makes you a better clinician. Yes. Because you know the most recent, evidence in many areas, and at the same time, it reminds you, of why you're doing the research. That it's important to have the good information for your patients.
That was one of my biggest takeaways of working here at the Regional Clinical Dental Research Center. It was eye-opening to me that the reason why we do it this way in private practice is because of the research. Mm-hmm. And I got to see the other side of that working here. Mm-hmm. It really opened up my eyes, not only for what we can do as a clinician, but why we do what we do and how it affects the population, not just one patient at a time. Mm-hmm. Yeah.
So let me describe to you how you asked me what my day-to-day looks like.
Yes.
So rather than putting it in the dry terms, let me describe to you a couple of projects that I've been working on recently. Perfect. That have been really fun. So one of them, and that you and I were just talking about, is the fact that one of the investigators that I work with is the reason that we now have silver diamine fluoride here in the United States. So he basically got FDA approval for it and brought it to market. And in doing that, there's certain things that the FDA required. And so I've been involved in some of those studies that the FDA required to make that happen. Mm-hmm. One of them took place actually in Oregon, because in Oregon, the dental hygienists there have an expanded practice permit. Mm-hmm. So the hygienists could go out into the Head Start programs and actually evaluate the students there, which is a requirement of being in Head Start for the kids to get the dental exam. Mm-hmm. And so the hygienists would go out and do it, and then they could apply the silver diamine fluoride. So my job in that regard was twofold, as you know, and I don't know if your students know yet, but to conduct research, all research has to be approved by an institutional review board. Mm-hmm. So an institutional review board makes sure that you're meeting federal requirements that protect the subjects, whether they're children or adults who volunteer to participate in this study. So my job was to go through that, the regulatory requirements, as we call it, and that's a lot of paperwork where you're explaining basically to your institutional review board in lay terms, what the study's about and why it's important to conduct it, and getting that approval. And then I had to train the hygienists in Oregon on the study protocol, exactly, what they had to do when, how to consent the subjects, and then apply the silver diamine fluoride. Mm-hmm. And I point that out because what is obviously fun is not only, going to Oregon and participating and going to the Head Start programs and seeing those cute little kids, but was the fact that the result, this was one of the studies that contributed to silver diamine fluoride getting the FDA breakthrough therapy designation, which of course it's the first agent in dentistry to have received that designation. Typically, that is given to fast-track studying drugs like for HIV, for cancer, for life-threatening things, and that the FDA saw the chronic disease of caries in children as being so important to give it this designation. Actually means they're funding a very big trial right now on SDF. So getting to participate in those kind of things. Something else we're doing right now is we have a study at the Yakima Valley Farm Workers Clinic in Yakima, obviously.
Mm-hmm.
And there what we're looking at is, as you know, I think hygienists are, I'm sure, learning in school that what causes caries is obviously you have to have sugar in the diet. And sugar-sweetened beverages is the number one sugar element that kids get in their diet, we get in our diet and causing caries. So this study is looking at what we call an environmental intervention and a behavioral intervention. And so what we're doing is we want to substitute water for the sugar-sweetened beverages. And we are doing that by, let me grab my little prompts here. You probably wondered what my bottles were.
I did. I love the colors.
My cute little bottles. I don't know if you can see these. These are made by Orca Beverage. These come from Orca Beverage in Mukilteo. And so this is one of the things that's fun about research. We worked with a company to actually get them to, rather than their sugar-sweet beverages that they normally put in these bottles and all other kinds of bottles, to take these bottles and fill it with regular fluoridated tap water. And so they do that, and they package up the cartons, and then they're shipped over to the Yakima Valley Farm Workers Clinic. And there we take the cases of bottled water, and we take children who have been diagnosed with severe early childhood caries. In other words, basically, they're under 6 years of age, and they've had rampant decay. And their decay has been treated under general anesthesia. And so we know that between 50 and 75% of those children will have recurrent decay in 2 years because we haven't addressed the root cause. We've just treated the symptoms. Mm-hmm. So this is designed to take those, invite their parents to participate and be willing to have the kids receive the cute little bottles of water in the animal bottles. And then the parents also have a dietary intervention. So they meet with, because it's a medical dental clinic that includes nutrition services, and they meet with a nutritionist who helps them goal set on behavioral changes they can make in the family. So the nutritionist doesn't tell them what to do. Mm-hmm. She invites them to make suggestions about what they might do to incorporate the water into their diet. So again, my job has been to do all the regulatory for this. And get approval from the Institutional Review Board to be able to do this with parents and children. And then we've been in Yakima, and we put the whole study together. Research is such a creative process, mm-hmm. like coming up with the bottles and working with a company, finding a company to do it. And then, putting together the forms and the notebooks and going over and training the staff. And we have weekly conference calls and the online database for them to enter the data. So that's one of the fun things. I've also been in the South Pacific recently over the past couple of years because children there have rampant decay, and we've been looking at a couple of agents to address decay, both preventatively. And so I've been there as a calibrated, what's interesting is hygienists can be calibrated dental caries examiners, even though we're not diagnosing because we are not determining what the treatment is.
Yes. Okay.
So all we're doing is pattern recognition. We're recognizing the pattern on the tooth as what stage it is, okay, of dental caries. Okay. And so I have been there. I basically, helped you work with the investigator, putting the study together, getting the IRB approval, the regulatory, the forms together. You're also figuring out, how are we going to conduct this? Who are we going to work with? As you know, when we did the xylitol study, we had to figure out, where we got the gum and how we were going to package the gum and how we were going to get people to chew the gum
and the labeling of it. And
yes, and the same thing with the gummy bears. So it's a very, very creative process, and more and more it's reaching out to various populations. It's not just taking place in our clinic. Of course, we do, some things here too in our clinic. We may look at, crowns. We've looked at gingivitis recently, things that have come to market, like Arrestin. We were one of the sites here that got FDA approval for, say, Arrestin or Orachix, so lots of different things. It's very fun, very creative. Anyway.
I know you accepted that invitation as a student, to be a hygienist at the FEARS clinic, the Dental FEARS Research Clinic. did you always know that you wanted to pursue that route, or did it just seem interesting to you? Or?
Oh, so good question. When I had done, so I think you have a much more advanced program for learning research methodology now than when I was in school. But I graduated from the University of Washington. That's where I got my bachelor's in hygiene back in the day when they had a program. And at that, for a bachelor's program, research was required. So my research was basically, a survey of the literature on a topic. And so we had some introduction to it. I think not nearly probably at the study design level because it's advanced a lot, since I studied. But it always interested me a lot. It was very, you're putting together the pieces of the puzzle. You have the questions. And it's not just, looking at the literature for information. That's important that we learn how to do that. But for all the unanswered questions, figuring out, how could we answer it? And as I think when a research team comes together, research dental hygienist, the research assistant, the investigator, the psychologist, the dentist, whoever it is, you come together as a team to try to design what your intervention is going to be to answer this question. So again, it's that creative process, and it's also a very much, dental hygiene. I love patient care, but it's very hands-on, and you're doing that mechanical thing sort of over and over. And of course, you're thinking a lot about the patient and what they need and so on. But research is very much engaging in that. Sort of mental process of how do we figure out this jigsaw puzzle and how do we put it together. So I knew I'd always, from my, education, knew that was something that interested me. And then when I came back here, of course, I was working with people who were all doing that. And the thing about people who do research, one of the challenges is sometimes your hours are not 8 to 5. They can be longer hours depending on your study and what's going on. So, that work-life balance can be a bit of a challenge. But the people who are usually involved, they love their jobs. They can't wait to get to work and work on it. So you're working with people who are very excited about what they're doing. It makes it a lot of fun.
I am sure. Yeah, that would be a perk of the
big
role.
A big perk of the role.
Because everyone wants to work with in an environment that people are happy to be there.
Yes, exactly. Yeah.
What would you say would be an important essential skill to have as a researcher?
Well, I would say that hygienists are actually really good at it because they are typically people who are very well organized, with a lot of attention to detail, and which is necessary when you are following a research protocol. So you figure out what it's going to be, and it's pretty much A, B, C, D, and B always comes after A. And C always comes after B. You don't flex around like you might in clinic because things are in a certain order for a reason. But research projects always have an end.
Yes.
So it's very detailed as you go along, but they come to an end. And then you're on to something else new and getting to learn about something new. So I think hygienists are good because they are very capable of doing that, following those details, being organized. I mentioned about I've been a calibrated examiner for caries studies using different indices, and for periodontal disease studies. And hygienists calibrate really well. Actually, I won't go beyond that. I will just say that they calibrate excellently for these things. So, in terms of that pattern recognition, and I think it is because, like you could imagine in perio, in terms of probing, they're very good at that. So for doing periodontal disease assessments, you can see why they'd be excellent. Yeah. That's the same thing with dental caries.
So in clinic, really switching back and forth between that Marquis and UNC would be a good thing to learn both, right?
Yes, absolutely.
I say that because
you never know what you're going to be required to use,
right.
Based on any given study.
Yeah. Very good.
Yes, and you do learn to use new equipment, as things come along because that's what the study entails. So.
And I'm sure that you're probably exposed to using different technologies, right?
Yes.
That you may not otherwise.
Yes. Well, because like one of the studies that we're doing right now involves scanning. And actually in this case, the dental assistant, Mary Kay, our research dental assistant, is the primary person involved with that because it's scanning for inlays and onlays and crowns. And so, so you are using that kind of equipment and technology.
Very interesting. Yeah. So I imagine you must have some sort of advanced degree. to be in a role that you're in?
So, you know what I would say about advanced degrees is, so I do think that it really helps having a bachelor's degree, at a minimum. That just kind of being the threshold that people will look for in a job, and particularly when you're working in an academic institution. The degrees are important at academic institutions. The other piece of that is, I think, as you will attest to, is more and more people are getting a master's degree in whatever it is.
That's true.
When I graduated from school, people had their physical therapists had a bachelor's degree. Pharmacy was a bachelor's degree. Those have both gone to doctorate degrees now.
Amazing.
So more degrees are required. So I do think in that regard, thinking about, then sometimes people don't do it right away. I don't believe in that if you don't continue right on, that you won't ever do it. I don't think that's true.
Yeah.
I think people come back now very often to school when the timing's right to get that next degree. They realize that that's one of the things I think is wonderful about our education system, is the door is open for things like that. So, but I do think down the line having an advanced degree is very helpful in that regard, particularly in an academic institution. And I think as time goes by, more and more people will need even PhD or a doctorate degree for research. And one of the aspects of it is I do a lot of implementation. So the investigator comes to me very often, at some stage with an idea, and it may be fairly well fleshed out or not. And then I contribute a lot in the methodology section because I've done a lot of the implementation. So a lot on the hands-on, how are you actually going to get this done? And sometimes it's just in my court to figure out how it's going to be done. There's wonderful teamwork in that regard, and a lot of respect for hygienists and the skills they bring to it. But when it comes to actually finding funding, and so if you have ideas that you really want to pursue and then want to apply for grants, I think you're going to find more and more that people need higher level degrees, masters at a minimum, and even more likely, a PhD or some kind of a doctorate degree, whether it's doctorate in education or health policy, but to get the funding. So that's where the higher degree is going to be coming in.
And no pun intended, but that's where it pays off.
It pays off, exactly. Yeah.
So while we're speaking about the advanced degree, I know the University of Washington has a summer institute for research. Would you think that would be beneficial for someone who's looking into this research role?
So yes, so that is it is a 6-week course, and it's attended by people who come from all over the world. So one of the fun things about it is meeting people from other countries, and they come to learn the basics of research. They're probably trying to do something. They're typically at an academic institution, either somewhere else in the U.S. or in another country, and they want to learn something about how to apply for grants, how to write a grant, about behavioral research, about biostatistics, about microbiology, what you do in terms of lab studies. So it's a 6-week course. It can be pretty intense, but would be a great basic. It costs something for it, but it's it's not like paying tuition by any matter of means. I can't remember what the cost is offhand. It may be something as low as like $1,000, which is a lot less than any tuition.
Yes.
But it would be a great way to get started. And you bring up an important point: is research isn't something that you are going to apply for the job like you applied it for private practice, a job in private practice. That's easy. It's pretty, cut out exactly what you're going to do. Research is something that you sort of more have to be creative about finding your pathway into it. So, for example, I think I described that, after I'd worked, I wanted to do something else. I worked at, community college in dental hygiene, then took a job here at the university. So I positioned myself so I was available when this grant came along. And then I'm a known entity, and then they asked me to work on it. So that is the kind of networking and positioning that people need to do so that when the opportunity comes, you can say yes to it. And I think that, participating in something like the Summer Institute is great. You'd meet the faculty here at the University of Washington, who are the main researchers in the School of Dentistry. So, that's the kind of networking. Networking through, one of the things I use a lot is the American Dental Hygiene Association. So I have been, been on the council on research there, helping to guide research. We helped rewrite the most recent dental hygiene research, National Dental Hygiene Research Agenda. And there will be another iteration in a couple of years as people, update and find ways to make it more useful. So, that is a great networking opportunity, especially as more and more people are getting involved with it. So I think researchers, they just had the International Association for Dental Research meeting in Vancouver, BC. So a lovely venue for that. And the reason people go to that meeting, of course, is they present their research and their posters, but the main reason they go is to network, to have the opportunity to talk with other people who are doing research and hear about ideas, and then connect with those people. Because research is becoming very interdisciplinary. One person doesn't do it on their own anymore. It's a team. So I think that, more than anything, that's important. And if you go out into private practice after you graduate and you're honing your skills, that's wonderful. But then you start laying the groundwork for, what are my connections? How am I going to network? How am I going to start meeting people? So I know when something comes available that I can say, my motto, yes to that opportunity.
You are famous for that.
And the one I will just add that, all those things I've been asked to do, I did not know how to do them when I said yes to it. I was a dental hygienist completely by training. So I said yes, because these people who invite you, they need someone to do it. And they'll always say, I'll help you. I'll teach you. I'm willing to help you learn how to do this. So remember, these are people who are very excited about what they're doing. And, so when they invite you to do it, they're in it with you. So, you're stepping through that door of things you, just like going to dental hygiene school, that you don't know how to do and you're learning to do them.
Yes, absolutely. And Marilynn gave me that same advice 14 years ago.
and Kelly took it to heart.
I did, and it's still something that when an opportunity presents itself, that I consider it because Marilynn told me to so long ago. So you've painted this really wonderful picture of a hygienist in a researcher's role. What advice would you give someone who is interested in pursuing what you're doing?
Well, I think that, getting the bachelor's degree, obviously, I would think long-term about getting a master's. I'd have that on my radar, definitely. And then, as I say, a lot of research takes place in an academic institution. So, the University of Washington, for example, is a research institution. So all departments here, all faculty are basically required to be doing some kind of research, pretty much. So with that, if you're really interested in research, getting your way into some area of academia can be very helpful. And oftentimes you start out as a clinician doing something, if they have a clinic. We have a faculty practice here, and we have hygienists who see patients, but they're getting to know people, and when something comes along, we did a project looking at the Seattle sweetened beverage tax in Seattle, comparing people in that area who had lived in the Seattle area, and then who live in South Seattle where they don't have the tax. And, hygienists who are working here were recruited to become calibrated dental caries examiners and actually, do the evaluations, on these patients. So, they're here, you're a known entity, and that's how recruitment for these kind of things starts.
I can definitely see that in my own experience being here for when budgets end and things like that. You're already here, and someone might need you, and so that's how you can continue staying here.
Working on another project. Yeah, exactly. Yeah. And on each one you get to learn something new. So it's very stimulating.
Yes. I loved my time here. Well, Marilynn, thank you so much for your time and for contributing to our course. We really appreciate it.
Thank you, Kelly. Yeah.
Thank you.
So I wish all the best for your students. Hygiene is so great.
It is.
There's so many different things you can do. I hope that they have as much enjoyment out of it as you and I have had.
I do too.
Yeah.
Thank you.
Thanks.